Most people are confused about the 5-star rating for Medicare Advantage and prescription drug plans. Today I'm going to dive into that, explain that, and simplify it so you can understand. So I'm going to read some information to you today in the video just to make sure I can clarify what is the 5-star rating system and what was it meant to measure. It's actually meant to measure plan performance, quality of service, and then the client's satisfaction. It was meant to solve the problem of navigating the complexity of Medicare plans and to help people 65 and older identify high quality plans more easily. Now, I have my own take on the 5-star rating. I'm going to give that at the very end. Stick around just a second. I'm going to dive more into details about the 5-star rating. So why was the 5-star rating began and started in 2007, and what does it relate to you? Well, one of the reasons that they did that was they wanted to provide a matrix that the plans were rated on the quality of service, customer service satisfaction, health outcomes, and then preventative services. They wanted to be able to kind of create this benchmark, and then they were going to reward plans, which I'll talk about in just a second, that had 5-star ratings. Part of this was accountability to the providers. And what this meant is Medicare Advantage plans are going to have to partner with primary care and specialist hospitals to create better health outcomes for the Medicare Advantage members that were enrolled into specific Medicare Advantage plans. So the 5-star process for Medicare Advantage plans really changed the customer service experience when it came to what we call continuity of care, managed care outcomes. So people that were sick, that were having progressive disease issues, the Medicare Advantage plans had to engage with the doctors to come up with a somewhat of a formulated plan of action to help minimize the health risk of these members of Medicare Advantage plans. So part of this was ease of choice. So basically Medicare thought if we have a 5-star rating, Medicare beneficiaries will just look at the plan options, choose a plan that's based on a 5-star rating or 4-star with a high rating, and then it would simplify the process for enrollees enrolling into Medicare Advantage plans or prescription drug plans, either or, into higher rated plans. But that didn't really solve the problem that we're going to talk about in just a minute. So 3 key points on how the star ratings work. One is quality measures. So quality measures of plans are rated on a variety of factors, including, not all of these are listed, but the 3 primary are customer service, how responsive and helpful the plan is to you as the customer. 2, health outcomes, whether the plan helps beneficiaries stay healthy through screenings, tests, vaccinations, and managing chronic conditions. And then the last thing is member satisfaction, surveys from plan members about their experience. That last one is supposed to be a help to you, but a lot of times you're going to find in any Medicare health plan that you choose, whatever you choose, and even dealing with the government with Medicare itself or Social Security, customer service is out the window. So stick around. I'm going to cover some other key details when it comes to the second thing that's important. So ratings are published annually. Now they come out before the annual enrollment period starts October 1, and plan star ratings are released. Sometimes they change the star ratings. They actually release additional star ratings, increases, decreases to us, and we have to put those in with the information that's provided to you if you're looking at a Medicare Advantage plan or a prescription drug plan. So the ratings are released every fall, allowing beneficiaries to compare and choose a plan during the annual enrollment period. So impact on plans. One of the things that CMS did get right in 2007 for plans that performed well with this matrix and did get a 5-star rating, actually allows people to have a one-time election throughout the entire year. They can choose to enroll from one Medicare Advantage plan into another 5-star rated Medicare Advantage plan. That's a huge help for those that maybe missed their open enrollment period from January all the way up to March 31st each year. You can make one plan change. If you enrolled into the wrong plan during the annual enrollment period, you're in the special enrollment period called the open enrollment period. You have one time, but you missed that. Now all of a sudden you're stuck in a plan. What do? You can look for 5 plan options in your area or 5-star plan options in your area. If you have a 5-star option plan in your area and it covers the doctor or specialist or whatever your needs are, you can enroll into that plan. Basically, through that 12-month period, you have one election to enroll into a 5-star plan. That's a big benefit. So what makes a plan high-rated or low-rated? Well, let me read this to you. High-rated plans that excel in providing access to care, managing chronic conditions, and delivering exceptional customer service get higher ratings. Demonstrate improved outcomes and high member satisfaction. So here's the problem with high and low-rated plans. The reality is you can have a Medicare beneficiary, maybe they're sick, maybe they've had a bad situation with their doctor, their health plan, maybe they got a bill in the mail and they're very frustrated and they're angry and upset about something. Sometimes they will retaliate or take it out on the health plan that they're enrolled into. So they call in and file a complaint against the health plan. And after so many complaints, that can actually lower the rating. Now, the reality is that just because the rating of the plan is low based on certain customer matrix, it doesn't always mean that plan is actually bad, which is going to lead me to what I'm getting ready to share in just a second. So all of this being said, it leads me down to this, my perspective as a broker. I believe Medicare Advantage plans and prescription Part D plans, especially Medicare Advantage plans, are based on three primary things that you're looking for. One, does it cover my primary care doctor? Two, does it cover my specialists and hospitals? And then three, is it going to cover my medication costs and lower my overall cost? And then does it provide catastrophic coverage in that if I'm extremely sick, I'm not going to be paying tens of thousands of dollars? So Medicare Advantage plans are going to do all of those things if you choose a Medicare Advantage plan based on your doctors, your specialists, your medication. But reality is you're really still choosing the plan that covers your doctor, your specialist, your hospital, and has a huge network, and then has a very good plan benefit when it comes to the co-pays and costs for your medications. Those are the key items. Most Medicare beneficiaries do not look at the 5-star rating as the choice of what plan they're going to enroll into. They may factor that in, but it's a very small factor. With thousands of Medicare beneficiaries since 2007 that we've enrolled, most people never mention it, even though we have to bring it up and share that with them. It's not a factor that determines enrolling into the plan. So don't let the 5-star rating confuse you, fool you. Choose the plan that covers your doctors, covers your specialists, covers the plan needs and things that you need. Based on that plan, you're going to choose the right plan for yourself. Guys, you may want to deeper dive into everything we've been talking about and a lot more about Medicare health plan options, and everything that you can choose when it comes to your plan options. If so, click below. We have a free on-demand Medicare Made Simple workshop, and we also have live Medicare Made Simple workshops that you can register for. And also you can schedule a time to be able to talk to one of our licensed professionals to guide you through exactly what we talked about. We'd love to help you. Click below.